you to get into a magnet for a brain and a spinal cord, and your doctor may ask you to actually get an injection at the end of, towards the end of the exam. So, but we do this on a routine basis on all our patients right now, whether they're early in the disease or even later on. So clinical and imaging to monitor disease progression. Another aspect of this, which is a little bit difficult, but we do that at our center, which is we tend to measure brain volume and what people call brain atrophy. Brain atrophy is normal. I myself am losing cells and losing brain tissue every year, unfortunately. Dr. Burdett likes this. I'm sure I'm losing more than you, Dr. Burdett, but I am. So if you do hear, the point I want to make is if you do hear about brain atrophy in MS, let's be sure that it happens also in patients without MS. So brain atrophy is a normal aging process. It may be accelerated in MS, but brain atrophy is a normal aging process. And we have developed tools, actually, to measure that more precisely.
There's a question about the names of the two therapies I mentioned regarding remyelination. One of them is called anti-LINGO, and the other one is called Plan 9 from outer space. No, it's an antibody that promotes remyelination that was developed at the Mayo Clinic. It's currently referred to as AB22. There's other agents that are actually being studied as well. We're doing a small trial of an antihistamine, clemastine, at UCSF. The point I wanted to emphasize was that we've been hearing about therapies that promote remyelination in animals for a number of years. What we're starting to see them is being brought into clinical trials in people with MS. So we're seeing advances on a number of fronts. Do you all know about clinicaltrials.gov? If you don't, that's a good resource. It's clinical trials with no period or anything. Clinicaltrials.gov, G-O-V. You go there, you type in multiple sclerosis, and it will list, today it's got 1,200 clinical trials on it. Some of them are completed, some of them are being planned, and some are enrolling. You could type in multiple sclerosis and remyelination, and you'll see a list of various therapies that are being done. So it's a good resource, an inspiring resource because of the large number of studies that are being done, and they're described at that website.
I have, this is an intriguing question. It's remyelination affect scar tissue from previous lesions, and what is there to do with that? I think that that's an important question. Right now, we don't know if the scar tissue certainly impairs remyelination. So, but I think that some of that may change when we have the growth of new axons and when we can basically dissolve the scar tissue, and all of those things are possible. I would make one point, that some of these things are engineering problems. And I think that we, in the next few years, are going to see the ability to bypass scar tissue and injuries by engineering methods to have people use their lower extremities, and that's already being done. I think that Christopher Reeve Foundation has been a pioneer in that area, and I think that the troops that have been coming home with these kinds of injuries are finding that they're able to do things. So this will be a combination of robotics, engineering, and agents that will deal with the scar tissue. But scar tissue right now is a major inhibitor of repair and remyelination.
I'll take the next question. I have a question here about why are drug study no longer including placebo? And you have heard that in the past, trials were actually comparing promising drugs to patients who were receiving a sugar pill. And the reason why we can't do that now anymore in most cases is because there's so many drugs that have a proven efficacy. So it would not be ethical to actually have patients get in clinical trials and just receive a sugar pill. So this is for forms of MS that have FDA-approved medication. We still have studies with placebo for patients who have progressive MS because there's no drug approved now for slowing down progression of MS in this category of MS. And the day we'll have a drug, then we'll be challenged because we'll have to do studies versus already existing medications, which impacts actually the length of the study, the number of patients that have to be enrolled. These studies become bigger and bigger and more difficult to perform actually.
Okay, so I'm going to go ahead and just get through a few of these great questions quickly as I can. So question for Dr. Kaplan. I've had MS for 45 years, seen many doctors. None have ever asked to examine...
Can you hear him?
None have ever asked to examine me for depression. So basically, there's a very simple way of screening for depression, which is for the past month. Apparently, if I get too close, I get some reverb. For the past month, have you more days than not been having trouble with feeling low, loss of interest or pleasure in doing things, or low mood? That has about a 98% sensitivity for depression. It's only about 50% specific, meaning that it'll grab most people. So if your get up and go has gotten up and gone, or if you find yourself sad without any reason. So that's what I hear all the time. Patients say, well, there's no reason. I've got a great spouse. I've got kids. There's no reason I should be down. That's also a pretty good indication. But there are some screening tests out there. The best thing to do is just, if you're concerned about it, it's something that should be addressed. And it's something that you can usually just ask your neurologist to screen for, but if you have any concerns or questions, you can be referred to a mental health professional. Is all depression and MS treatable? So the good news is it didn't have to be the case that depression and MS would respond to the treatments that we have, but it turns out the treatments we have for depression are downstream. So MS causes inflammation. It causes that causes the depression. I tell patients that the goal is to get 100% well, meaning 100% back to the old person you were in terms of your sleep, your interest, your feeling about yourself, your concentration, your appetite, your energy levels, and the like. If you have thoughts of death or life's not worth living, that's a psychiatric emergency that needs to be tended to. Just like if you have, weakness or numbness on one side, or you have chest pain, those are emergencies. But the goal is always to try to get someone 100% well. And yes, that's doable. People all the time are willing to stick needles into their bodies and do aggressive management for their MS. And trust me, it sometimes takes aggressive management for the depression, but it is treatable. I will tell you that one of the interesting things, Hopkins is one of 10 sites testing a new drug called S-ketamine. We're trying this out. This is a treatment that works in hours, not in days or weeks, in some of the preliminary studies to reverse the symptoms of depression, and that's very exciting. What's also exciting about S-ketamine is it turns out to be anti-inflammatory, again, suggesting that the relationship between MS and depression and inflammation is very tight one, so it's not surprising there. The other question is, my friend's on amantadine. Does that help with fatigue? Bar none, the best thing to help with fatigue is exercise. And if you can't, run or what have you, swimming, non-weight-bearing exercise is great. It helps with fatigue. It helps with the physical symptoms. But in my experience, Provigil, Nuvigil, these are stimulants that tend to be highly effective in the fatigue that comes with MS. Also making sure you have good sleep is also important. Other people may want to weigh in on that. How secure is Mood 24/7? So it's HTTPS, meaning that it's just as secure as your online banking and the like, and it's stored on a HIPAA-compliant server. So it is very secure. The last thing is This is the PG-13 question, sexual dysfunction and antidepressants. So yes, and it depends on what kind of sexual dysfunction you mean. Turns out Paxil is very, very effective for premature ejaculation because it delays ejaculation. However, that can be a sexual side effect for many people as well. So I can tell you that you women are very complicated, and we have not been very good at figuring out how to remedy the sexual side effects of women in general. However, if it's due to antidepressants, it turns out Viagra, Cialis, Levitra, these medicines actually are good for counteracting the sexual side effects. And I will tell you that Wellbutrin has no sexual side effects, and in fact, it decreases the difficulty in achieving orgasm. So that is, for women especially, and for men, it sometimes improves sexual function. The one thing about Wellbutrin that you need to know, though, is it does, at the higher levels, decrease the seizure threshold. So MS has a higher rate of seizures. So especially if you drink alcohol on a regular basis and more than a cup or two a day, you need to be aware of this. A lot of times the medicines we use to help pain, like Neurontin and the like, these are anti-seizure medicines. So I'm always more comfortable with people being on the higher doses of Wellbutrin.
So how do you follow up on that? I'll just do a few quick ones. And in terms of genetic testing, with knowing the number of these genes, we're not yet there. We've identified 180 have been published. We'll have about 250 by the end of the year, and we're examining how much predictive value it has. But as of yet, there's no genetic test. There were a number of questions about primary progressive MS. Does interferon work better than Copaxone? No, neither drug works for progressive MS. Again, as much as we know about the inflammatory relapsing remitting form, as hard as we're trying, we still don't understand progressive MS. What was the other question? Okay. And there was a question related to progressive MS. Maybe I'll turn to Emmanuel, related to statins.
Yeah, so one of the questions I have here is about a recent study with Zocor that was published. So Zocor is actually a medication that is lowering cholesterol. And this is a British group that has studied whether treatment with Zocor versus placebo decreases the progression of MS. So the short answer is that there's an effect on slowing down. The bottom line is that I would not start patients who are not on these medications already on one of these anti-cholesterol agent, because it's unclear whether they would have benefits, and they also can have side effects.
Some questions for Chad.
I got a couple questions about my experience of being diagnosed with MS. Well, I'm sure anyone in the room who has MS can probably relate, and I don't think it was necessarily any different. A lot of shock and how could this be? I think what I did at first was I tried to do as much research as possible. And Nancy was one of the first people I called because I obviously was aware of the foundation and family, friends, and such. For me, research is power. The internet can be a great resource, but also a very scary resource. I had to kind of really pick and choose wisely as to kind of what I was taking on board. I'm going to kind of answer two questions with this, but one, when on the internet you start reading about other treatments, diet, exercise, some people are on meds, some people are not, and I began researching about how at the end of the day, this is an autoimmune disease, and your immune system is, as strong as you can get your immune system, the better. That's what I was kind of looking at. And so I kind of started exploring, well, how do I get my immune system as strong as possible? That led me to reading about stem cell treatment. I do take, I'm on Copaxone. I do 3 times a day Copaxone now, but when I diagnosed, I was on the once a day. But I actually ended up going to Germany and getting stem cell treatment to help rebuild my immune system. It was injected. It was blood stem cells taken from my own blood. They cultivated them, and then I had it injected into my lymphatic system. That was a year ago, and it had been pretty good. I haven't even actually had a cold or anything in a year. So as far as my immune system goes, it's well. I don't attribute the stem cells solely to my well-being. And as far as the MS front goes, I just attribute it to it as a complete overall body health. Because at the end of the day, I think that's what, for me anyway, what I'm trying to achieve is overall health, not just health in the MS front. So thanks. I've actually been, he was asking what the MRI result has been after stem cell. I actually have not had an MRI in about a year. It's on my agenda, and my doctor keeps calling. Doctor says I need to get an MRI soon.
But I think it's important to point out why a single MRI in a single patient doesn't help that much. Why we need to do studies
Because it's not
hundreds of
working.
patients in a randomized fashion to learn something. Those very powerful placebo effects we've all seen, and we want to get to the truth. That's what medicine and science does, as opposed to, I think it works because I tried, I feel better, therefore it works. We move more from the show me state to show me. And that's an important part of science. It's not one MRI, that's enough. Actually, you don't. You actually start by doing randomized trials. One group gets one thing, one group gets another. And it's important for getting to the truth.
Can you hear me now? Yeah. This is a question that comes up, and this is better. I need two microphones. Maybe not. Okay. Hot topic among us, and there are actually four authors on the Erase to Erase consortium that are studying this. It shows great promise. Well, that's three microphones. This is...
Maybe less, it's because you've been talking too much, so you're wearing the microphones out.
This is not working either. Is this... Hello?
There's a demyelinating event somewhere.
All right. Can you hear me now? Yeah, all right. Thank you. Thank you. There is no question.
It's like MS, it's progressive.
Check, check, check. Is that good? Should I sing? Anyway, this is called the microbiome, and there is a lot of attention in all the autoimmune diseases to the gut flora, which is the bacterial content. We have no hard evidence yet, but it's being studied in type 1 diabetes, rheumatoid arthritis, MS, lupus, and a variety of other kinds of autoimmune diseases. And quite clearly, the data now is being accumulated, and hopefully in the next year or two, we will have some idea what the importance of these things are. There are specific bacteria that have been shown in MS to perhaps be important in modulating the immune response. I think it's also very important that with all the attention to probiotics, et cetera, that those not be abused. If you change the flora of your GI system, you may actually be doing more harm than you can imagine. So I was recommending that they just use these probiotics as is instructed on the label, and not to take it 3 and 4 times more than you're supposed to. The other thing is, we're just inundated with antibiotics in just about all of our food, particularly those who are not vegans. And I think that we don't really know the effect of that is. So again, I would be careful with antibiotics. I would certainly not take the probiotics to a greater extent than has been recommended by the label in the manufacturer. We will have the answer to this, I think, in the next year or two. And as I say, it's a major focus of modern research on autoimmune diseases.
Okay.
This question,
Yeah, Claudia, go ahead. Sorry. Okay, we only round portion.
this question is, what have you learned about yourself as a patient with MS and your future? What I've really learned is that everybody has some kind of physical issue. I've got friends that have heart trouble and friends that have battled cancer, and the bottom line is you accept what you got. You certainly keep trying to make it better, but if your legs don't work anymore, use your arms, use your hands. And a friend of mine once said, as long as you've got your head and your